Assalamu alaikum. Hope every one of you is well and every one of you listened to our first lecture, the introductory lecture mainly. As you all know, we have started rheumatology. We studied few lines together in the first class. Now we will continue from the subsequent topics. So let's come to this topic, bone matrix and mineral. We are now studying about the anatomy and physiology, the basic things about bones, joints, and overall musculoskeletal system. So the first line, it is very important for any question, any exam throughout the world. That is, the most abundant protein of bone is type 1 collagen. So bone is a structure, is a connective tissue. It is composed of proteins, and the most abundant of them is type 1 collagen. So let's come to how you will remember uh, this bone is mainly composed of type 1 collagen. So when we write bone, we write a B and then we have to write 1. So the answer, the mnemonic, lies within the name bone. So bone consists of mainly type 1 collagen. Okay, so we are done. And type 1 collagen is a triple helical structure. So helix means chain, triple means three. So type 1 collagen consists of three chains. And among the three chains, two are 1 chains and one alpha 2 chains. So 2 alpha 1 and 1 alpha 2. These three chains make up a triple helical structure, which is type 1 collagen. So I hope you have understood. And if still you have confusion about this, you may comment. I will discuss it again in subsequent lectures. Okay. So let's come to a life cycle of a bone. Okay. So in the life cycle of bone, there are 4 main phases. One phase is quiescence phase. Quiescence means sleep. The bone is sleeping. It is not active. It is not building something or it is not destroying something. So neither building or destroying. So this is called a quiescence phase. Then there is a phase called resorption phase, when the bone is decaying, the bone is being destroyed, not entirely but partially. And the cell, which is the main culprit for causing, I will not say culprit, it is sometimes a beneficial effect, bone resorption. So the main cell responsible for bone resorption is osteoclast. And as we learned in the previous class, that osteoclasts are multinucleated cells, they are macrophage-like cells. Okay. Then, after the completion of the resorption phase, there is another phase which is reversal phase. Reversal means when something returns to its previous condition. Okay. So before resorption, the bone was in a normal shape, normal condition, quiescence. After resorption, the bones become thinner because it loses some things from it. And in reversal phase, so the bone gets back its lost thickness, I would say. So in reversal phase, the main cells responsible are osteoblast. Osteoblast are bone forming cells. Okay. Then after a reversal phase, there is formation phase. In formation phase, the mature bone cells or osteocytes are formed, and besides osteocyte, there is some matrix here. These are bone matrix, gel-like structures. So when bone matrix, in the later stages, in the bone matrix, there is deposition of lots of calcium. So when lots of calciums are deposited here, the bones become a hard structure, compact structure. So when there is very little or no mineralization of calcium in the bone matrix, that structure is called osteoid. So osteoid, no calcium or very low, very little calcium. Okay, these are the different phases of the bone remodeling cycle. Okay, so let's read out this. The bone remodeling cycle. Bone is renewed and repaired by the process of bone remodeling. This begins by removal of old and damaged bone by osteoclast during the phase of bone resorption. So as I said, bone resorption or the role of osteoclast is sometimes beneficiary because old bones which are not useful for us or damaged bone tissue not useful for us, those are destroyed by osteoclast. The process is bone resorption. So after about 10 days, the osteoclast undergo programmed cell death or apoptosis. We can see that here. These cells are undergoing a programmed cell death or apoptosis after 10 days. Okay. During the reversal phase, the osteoclasts are replaced by osteoblast. This is the reversal phase. The osteoclasts are replaced by osteoblast here, the bone forming cells, which begin to fill in the resorbed area with new bone matrix, heralding the start of bone formation. So it's simple. The bone matrix is initially uncalcified. As I mentioned earlier, this is the bone matrix. Initially, it is uncalcified or very little calcified. But then becomes mineralized to form mature bone. So it is in osteoid stage early when it is devoid of mineralization, and later it gets mineralized to form mature bone. Okay. So then we'll study this line. Any line that I have highlighted in yellow color is very important. So in bone mineral, there is deposition of, I said earlier, calcium. So calcium is a very simple word. As we are medical personnel, we'll have to learn it more accurately. So in bone mineral is composed of calcium and phosphate crystals. Calcium and phosphate crystals deposited between the collagen fibrils. So bone is composed of type 1 collagen. There is type 1 collagen tissue, and in between the collagen fibrils, there is deposition of those calcium and phosphate crystals. And this calcium and phosphate crystals take a form which is called hydroxyapatite. Hydroxyapatite. We will also have to remember the formula of hydroxyapatite. In hydroxyapatite, there is calcium, there is phosphate, and there is hydroxyl. Calcium 10, Ca10, phosphate 6, and hydroxyl 2. Okay. This is called hydroxyapatite, the crystal of calcium and phosphate in the bone mineral. So, mineralization. Everything should happen up to an optimum level. If there is overproduction of anything, that is also not good. If there is underproduction of anything, that's not good. So, over mineralization of bone is also not beneficial to us. Over mineralization causes bone to become brittle. So, increased mineralization can occur in some types of osteogenesis imperfecta. We will study about this topic later. And in response to long-term bisphosphonate therapy, we know that bisphosphonate is a class of drug that is prescribed to patients with osteoporosis. So osteoporosis is a disease where there is bone resorption. Okay. So bisphosphonate is used to treat osteoporosis. Okay, so bisphosphonate causes increased mineralization of bone. Okay, then let's come to bone remodeling. We have already studied the bone remodeling cycle. So the cycle has 4 phases: quiescence, resorption, reversal, and formation. Okay, next line. The osteoclast resorb bone and after about 10 days undergo programmed cell death or apoptosis. We have told this earlier several times. Okay. Then the osteoblast precursors differentiate into mature osteoblast and form new bone during the formation phase. That has already been discussed. Okay. Let's come to this figure. Okay. So the heading of this figure is cellular and molecular regulators of bone remodeling. Okay. When we say remodeling, there will be mainly 2 things. One is bone formation and other is bone resorption. Okay. So there are several factors that help in bone formation and several other factors that help in bone resorption. So we have to first highlight something. What do we need to learn from here? We will not just read out these things. We will try to remember what we need to remember for the exams. Okay. So there are lots of factors. So we will have to learn by 2 headings. One is which factors favor bone formation and which factors favor bone resorption. So factors favoring bone formation, not too much, only 2 factors. One is OPG, osteoprotegerin. Osteoprotegerin. We will know the elaborated form. We will know the spelling in this page. It is written somewhere. So we will not write the elaborated form here. You will just listen to me. Osteoprotegerin is one of the 2 factors that favor bone formation, and the other one is W and T. Here it is W and T. So let me mark these 2 with a different color. Let's mark it pink. So W and T and osteoprotegerin. I have written that here also. Okay. Factors favoring bone formation, osteoprotegerin and W and T. So I will urge you to read this 5 times to memorize. So factors favoring bone formation, osteoprotegerin and WNT. Factors favoring bone formation, osteoprotegerin and WNT. Factors favoring bone formation, osteoprotegerin and WNT. Okay. Then all other factors are responsible for bone resorption. And among them, mainly responsible ones are, let's mark it in red color. Rankel, macrophage colony stimulating factor, SOST. So these 3 are mainly responsible for bone resorption. So Rankel, SOST, and macrophage colony stimulating factor is cause bone resorption. I have written here also Rankel, SOST. SOST means, we told you in the first class, SOST means sclerostin. Okay. So let's read out this also 3 times. Factors causing bone resorption. Those are mainly number 1, Rankel, receptor activator of nuclear factor kappa B ligand. We don't need to know the elaborated form. I have just told you to hammer you in your brain so that you can remember. So bone resorption, Rankel, sclerostin or SOST, and macrophage colony stimulating factor. Then let's come to here again. Factors favoring bone formation, osteoprotegerin and WNT. Okay, we are done, I think. Let's read out the highlighting points of this figure. So Rankel produced by mainly 3 types of cells. Rankel, osteocytes, the mature bone cells, then bone marrow stromal cells, and activated T cells. So this information is important for MCQ. Rankel is produced by three types of cells, A, B, C. So those cells are osteocyte, macrophage, bone marrow stromal cells. Okay, Rankel produced by osteocytes, bone marrow stromal cells, and activated T cells. Osteocytes, bone marrow stromal cells, and activated T cells. Osteocytes, bone marrow stromal cells, and activated T cells. Okay. Macrophage colony stimulating factor. This also is released from bone marrow stromal cells, produced by bone marrow stromal cells. Then osteoprotegerine. So here is the elaborated form of OPG, osteoprotegerine. So this is produced in the bone microenvironment. It inhibits osteoclast bone resorption. So it inhibits the action of osteoclast, and thus it inhibits bone resorption. Then osteoblast activity is stimulated by WNT. WNT. Osteoblast formation is inhibited by sclerostin or SOST. Okay. Sclerostin is produced by osteocytes. Here we will see in this figure again. So OPG. Here we see that OPG is released by bone marrow stromal cells. OPG is released from bone marrow stromal cells. Rankel released by bone marrow stromal cells, osteocytes also, and also activated T cells as we learned. WNT released by bone marrow stromal cells. OPG and WNT both are released by bone marrow stromal cells. Bone marrow stromal cells. Okay. We can see another factor, FGF23, fibroblast growth factor 23. These factors are produced from osteocytes. What is its role? This FGF23 goes to the kidney and it causes increased excretion of phosphate. So it causes the kidney to excrete more phosphate. This is the role of FGF23, which is produced by bone cells, osteocyte. So osteocytes release FGF23, which goes to the kidneys and causes increased phosphate excretion. Increased phosphate excretion. So here is the written thing. Fibroblast growth factor act on kidney to promote phosphate excretion. Okay. We will finish today's this lecture with these box. These are the key regulators of bone remodeling. Okay. Rankel, osteoprotegerine, WNT, sclerostin, parathyroid hormone, estrogen, glucocorticoid. What will be our focus is to remember just one thing. Which factors cause bone formation and which factors mainly cause bone resorption. So by this time, we already know about lots of factors here because Rankel, we know it causes bone resorption. Rankel is produced by three types of cells, as I mentioned earlier, osteocytes, bone marrow stromal cells, and activated T cells. Then osteoprotegerine. This causes bone formation produced by bone marrow stromal cells mainly. So it inhibits bone resorption. Okay. WNT. Okay. WNT. It stimulates bone formation, also produced by bone marrow stromal cells. Sclerostin inhibits bone formation. Sclerostin. Okay. Sclerostin produced by osteocyte. Parathyroid hormone. Then we have to know this. These are the some endocrine factors. What is their role in bone remodeling? Parathyroid hormone. It increases both resorption and also formation. We will have to remember this. Okay, parathyroid hormone has both effects. Also, both in bone resorption and bone formation. This is the role of parathyroid hormone. Then let's come to thyroid hormone. This is the same as the parathyroid hormone. It has role both in bone formation and resorption. Okay, estrogen, 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 estrogen. We know one thing, one term, postmenopausal osteoporosis. Menopause means cessation of menstruation. So when a lady has undergone aging process. She has menopause. After menopause, uh, some of them suffer from osteoporosis. This is quite a physiological decaying process. So, postmenopausal osteoporosis. Why does it occur? Because the concentration of estrogen is very low in postmenopausal ladies. Okay. So, when the concentration of estrogen is low, it results in osteoporosis. So, what was the role of estrogen? It was to prevent osteoporosis. So, estrogen inhibits bone resorption. Okay. Glucocorticoid. Glucocorticoid causes bone resorption or inhibits bone formation. So, when we prescribe a prolonged dose of corticosteroid or glucocorticoid to any patient, we co-prescribe calcium to them for this effect. Glucocorticoids inhibit bone formation. Okay. So with this, we conclude this lecture. Very short one. I hope you will understand the topics that I have discussed. So what I have discussed, just 2 pages, I think, uh, about bone. It is it composed. It is composed mainly of type 1 collagen, triple helical structure, 2 alpha 1 and 1 alpha 2 helix. We have learned the bone remodeling process cycle, 4 phases: quiescence, quiescence, resorption, reversal, and formation. Okay, so we have learned about the mineralization of bone. The mineral is composed of mainly calcium phosphate, and there is a structure, crystal-like structure called hydroxyapatite. Its formula: calcium 10, phosphate 6, and hydroxyl 2. So then bone remodeling process, factors causing bone formation and factors causing bone resorption. Very, very, very important for MCQ and also for single best answer, SBA. Okay. Then the box, factors favoring bone formation and factors causing bone resorption. Okay. Let's study these also. Rankel causes bone resorption. Osteoprotein causes bone formation. So SOST, SOST causes bone resorption. SOST causes bone resorption or inhibition of bone formation. WNT, it promotes bone formation. We all know that. Osteocytes produce FGF23. It has a role in phosphate homeostasis. That means it causes increased phosphate excretion in the kidneys. So there is also another information important for SBA. This is mineralization of bone is critically dependent on one enzyme, which is alkaline phosphatase, ALP. Very important. Alkaline phosphatase is the enzyme responsible for bone mineralization. Alkaline phosphatase is produced by osteoblast. Okay. What is the mechanism of action of alkaline phosphatase? It causes degradation of pyrophosphate. Pyrophosphate is an inhibitor of mineralization. So when something causes degradation of pyrophosphate, there will be no inhibition of mineralization and mineralization will occur. So alkaline phosphatase favors mineralization by inhibiting pyrophosphate. Okay. Alkaline phosphatase favors mineralization by inhibiting pyrophosphate. So in the next lecture, we will continue from this topic, joints. Till then, bye. Allah Hafiz. If you have any query, any question, please feel free to write that in the comment section.